Okay, so this is your last quiz, I think, for pharmacology sa prelim. Ano ni siya sa chapter 4. So I hope you have answered it correctly. Now let's have the number 1. This is the only cholinesterase inhibitor derived from a plant source. So remember, pag cholinesterase inhibitors class, they are indirect acting. So dito ta sa indirect acting magtanaw, and then we only have one there, and that's the physostigmine. Remember, I have given you the plant source, it's Physostigma venenosum. Kasi ang uban nato ng mga cholinesterase inhibitors class are synthetically produced in the laboratory. So, kanilang ang alkaloid from a plant. Again, Physostigma venenosum. And then I have checked some of your quizzes actually. Medyo daghan ang mali din hinga part, no? Kay ang uban sa inyo you answered pilocarpine. Pilocarpine, though it is an alkaloid, it is derived from a plant source, but it is a direct acting anti-muscarinic agent. So direct siya sa muscarinic receptor. It has nothing to do with the cholinesterase or the acetylcholinesterase. Next, ecothiophate was once used for the treatment of glaucoma. Okay? Again, was once used, ha? So dati ginagamit siya for glaucoma. However, its use for glaucoma nowadays is obsolete since it's a very long-acting drug. It will stay in the body for a longer period of time. So medyo may problema ta when it comes to toxicity. And then state the process. So mo to nga wala pa score ang uban. Kaya wala pa na-answeran ang essay na part. State the process of myasthenia gravis diagnosis. So remember na we have the tensilon test. Mana siyang ato ang test for the diagnosis of myasthenia gravis. Tensilon test. Tensilon is a brand name of edrophonium. So when you want to diagnose a person suspected of having myasthenia gravis, you will be giving edrophonium 2 milligrams via intravenous injection. And then you will wait kapag nag-improve ang muscle strength, then that's positive, it's myasthenia gravis. However, if after some time there is no improvement in the muscle strength, then you can give additional dose like 8 milligrams via IV gihapon. And then let's see if the patient gains strength or he or she can open his or her eyes, then positive myasthenia gravis to siya. But if dili niya gihapon ma-open, then I told you it's called cholinergic crisis, wherein the person does not produce acetylcholine anymore. So medyo daghan-daghan class. I hope nag-start na mag-study itong ni Agi ha, kay exam na ninyo next week. Unya daghan pa kaayo ni siya. Okay, so I hope you have followed instructions here. Classify the following drugs and then write the capital letter of your choice. So ako ang instruction, capital letter lang. Pag dili to capital letter inyong gibutang, most likely malian na siya ni Schoology. Okay, very sensitive si Schoology, no? So we have the tensilon. This is the brand name of edrophonium. So onium, they are short-acting acetylcholinesterase inhibitor. We have B here. And then isoptocarpine is a brand name of pilocarpine. So pilocarpine class is a muscarinic. Sorry, mali din yung akong choices din. Antagonist dapat may. But anyway, sige, let's see kung unsa inyong answer. But it should be muscarinic antagonist. Okay? Antagonist kasi anti-muscarinic si pilocarpine. And then we have urecolin. This is a choline ester. So this is letter A. And then eserine is a brand name of physostigmine. So basta nag-end sa tigmine, it's an intermediate acting acetylcholinesterase inhibitor. Ecothiophate is a long-acting So muna na-mention ako kagaina, the reason why we don't use this for glaucoma anymore. And syempre, nicotine is a nicotinic agonist. At low dose ha kasi ang high dose nicotine will be an antagonist. Okay? Questions sa quiz na mga corrections? Himalian ni Pharmacology, wala? So I assume kung checkan na lang dito ang essay. So how about this? These are long-acting cholinesterase inhibitors used as warfare agent. And for terrorism, we have two, the soman and the sarin. Okay, they are nerve gases, sarin and soman. And then what are the two major receptors of acetylcholine? You have to classify them according to the subtypes of the receptors. And my instruction is you just have to write the Roman numeral form sa subtypes. Sarin. Soman tapos sarin. Okay? So we have muscarinic receptor. Muscarinic receptor is a metabotropic, meaning it's G-linked protein, G-protein linked siya na receptor, so it's class 2. And then nicotinic receptor, remember this is an example of a class 1 receptor kasi merong ion channel na ma-open, and specifically that's sodium. No need to write class because I have written class here anymore. You just have to supply the Roman numeral form just how I did it sa screen. Okay? Wala na answeran. It's okay. Yeah, okay, sige Belly. I'll be rechecking it kay ang ako ang gibutang manggod na answer key sa Pharmacology walay word na receptor. So mo to gimalian niya. Sige, I'll be rechecking this question here. Okay? Sige. 2 and 1 lang ha kasi I just want to see the Roman numeral name of the class. Next, acetylcholine works on the post-ganglionic neuron of the sympathetic division. This one is false. Again, this one is false. Why? Because, yes, acetylcholine can be found in the post-ganglionic neuron. However, it should be the parasympathetic division. Again, parasympathetic division, dapat siya, not the sympathetic division. So that's all for the quiz. It's 20 items all in all. So get ready sa exam. You prepare for the exam. Kasi pag abot sa exam class, I will really include like mga multiple choices na mga Morse types. So you really need to study. And you can rewatch the video of the discussion. I mean, the recorded video sa discussion. Especially if you have unstable internet connection, you might have missed something during the discussion. So I hope you find time to review. Ha? Ramuragdaghan kayo mo ginabuhat, no? Sige, let us continue with our lessons at chapter 5, the cholinergic antagonist. So a little review, class. Wait lang. Ayan, so a little review. When you say cholinergic antagonist, they are drugs that will block the action of acetylcholine and other cholinergic agonists in the receptor. Okay? So we can call them cholineceptor antagonist. My word, I mean, you can see in the word receptor kasi they block the receptors jud sa acetylcholine. Okay? So we have the prototype drug, the first ever anticholinergic drug or anti-muscarinic drug. It's the atropine. Huh? Atropine, which is also called hyoscyamine. Ang mechanism of action ng gidani nila class is they will just block the receptor, especially the muscarinic receptor. That is why mas specific kung ang tawag nato sa ilaha kay anti-muscarinic. Okay? So daghan og effect si anticholinergic, especially sa mata kay it will last to hours or days. Pero sa uban organ, that will be 4 hours only. Now, if you want to study the effect of atropine, you just have to reverse the dumbbells. Remember, di ba, the effect of acetylcholine is abbreviated as dumbbells. So, kung anti-cholinergic na siya, then you just have to reverse the dumbbells like diarrhea. What's the, it's ang reverse sa diarrhea, di ba? It's constipation. And then, what else? Kapag urination, di ba? Urination ang sa use sa dumbbell. So, ang kabaliktaran niya, urinary retention. The patient cannot urinate. And then, M is meiosis for dumbbells. So, ang kabaliktaran niya is mydriasis, meaning na ay pupil dilation, dumbbells. Bradycardia for B. So, kung baliktaron na nimo, it will be tachycardia. And other B is bronchoconstriction. So, ang kabaliktaran ni bronchoconstriction, it's bronchodilation. Okay? So, again, if you want to be familiar with the effect of the atropine, you just have to reverse the dumbbells kasi anticholinergic man siya. Okay? I think we are done with this. And then we have discussed also the scopolamine, which is another drug na similar ang effect kay atropine. However, ang ilahang difference is mas grabe ang effect ng scopolamine sa CNS. That is why this is given for motion sickness. This is an anti-motion sickness drug. But since it has a larger effect on the CNS, then we have to monitor the patient for CNS food na mga effects like we have sedation and then we have euphoria. That is why susceptible siya sa abuse. Okay? And then this one is a board exam question. The only anticholinergic drug used for asthma, it's ipratropium. However, we have a newer drug nowadays, and which is given once a day only. It's tiotropium. Okay, and then other anti-muscarinic drugs, isa-isa na to sila last time, pero parehas lang sila og application, clinical application. They are given to like elderly patients na merong urinary incontinence, ha? We call it urinary incontinence. Kapag ang patient is kapag kaihiun siya, mangihi na siya diretso, dili niya mapugna ng iyahang ihi. So gikan kay oxybutynin hangtod kay propiverin, ginahatag jud ni sila for elderly patients na may problema sa urination. Okay? Now, diri na karon, this afternoon we will be talking about the ganglion blocking drugs. Okay? Ganglion blocking drugs. Remember, ganglion, it's the junction between one neuron to another neuron. And then as you can see, if you can recall, sa ganglion, both sympathetic and parasympathetic, ang atoang neurotransmitter is acetylcholine. So mo na siyang nanapod tay blockers sa acetylcholine but specific on the ganglion. So we call them ganglion blocking drugs. Okay? However, class, ang receptor na most likely present in the ganglion is the nicotinic receptor. Again, when you say ganglion blocking drugs, these receptors, na receptor gihapon siya ni acetylcholine, pero this one is specific, it's nicotinic receptor. So parehas lang siya, nicotinic antagonist, pwede po nato tawagon o ganglion blocking drugs. So ang number one dyan, nicotine. But i-remind lang tamo na sa chapter 4, we have discussed that nicotine is an agonist of the nicotinic receptor. But again, it's dose dependent. So at low dose, yes, nicotine is an agonist it can stimulate the nicotinic receptor at the ganglia. However, at high dose, nicotine will become an antagonist in the ganglion. So that will cause, kung sa patient niya pag masubraan siya og nicotine, it will cause a drop in the blood pressure, and at the same time may effect siya on the genitourinary tract, so including the bladder and the gastrointestinal tract. Siya, since antagonist man, so ang kabaliktaran ni diarrhea, di ba, is constipation. So the movement, peristalsis will slow down until mag-cease siya if you will have poisoning or overdose of the nicotine. However, aside from nicotine, we have also other drugs that are considered nicotinic receptor antagonist. Yeah, 2-in-1 si nicotine, it's dose dependent. So the action is dependent on how much you have administered to the patient, how much drug or how much nicotine is administered to the patient. So, aside from nicotine class, we also have the tetraethyl ammonium, which is the first aside from nicotine first na nicotinic antagonist or ganglion blocking agent na na-recognized. However, the use of tetraethyl ammonium is like obsolete nowadays because it's a very short-acting drug. So pag very short-acting pud ang imuhang drug, murag bago pa lang nimo siya gi-administer, wala na dayon siya. Human na ang iyahang action. Pero may murag mahimo siya like insignificant. Okay, and then we have other drugs being developed as ganglion blocking agents. We have the hexametonium, which is used as a drug for the management of hypertension. So ginagamit siya sa high blood, in layman's term, pwede siya gamiton for hypertension. However, this is not common in the Philippines. We have a lot of anti-hypertensive drugs. It's just that this drug also exists and it can be used in this condition. Okay, and then we have the decamethonium. Actually, the structure is patterned sa hexametonium. It's just that the number of carbons ang ilahang difference. When you say hexa, remember it's 6. So it contains 6 carbons, while decamethonium, deca means 10. So naa siya 10 ka carbon. Now, unlike the hexametonium, decamethonium is actually a depolarizing neuromuscular blocking agent. At the end of this chapter, I will be discussing what do you mean by depolarizing neuromuscular blocking agent. Okay? Ako na lang siyang isahon. Unsay meaning anang pag moingon kag neuromuscular blocking agent. Next, we have mecamylamine. Ano ni siya? Gidevelop ni siya because we have problems with the other drugs when it comes to absorption via the gastrointestinal tract. So ang mga previous drugs na mention na ganglionic blockers except for nicotine, they are given intravenously. However, this one can be absorbed if you take it orally. So mo na siya ang purpose nga nung gihimo si mecamylamine. Now, para asa si mecamylamine, this one is an adjunct to nicotine. Diba may transdermal patch ta na nicotine, no? If the person wants to stop smoking, then hatagan na to siya nicotine kasi mo na siyang addictive substance sa cigarette. So, kaning mecamylamine, we can also give this to the patient as an adjunct. When you say adjunct, it's just an additional one para ma-reduce ang craving sa atuang patient to nicotine. And then, it can help them in quitting sa smoking. Okay? And then we have the trimethophan, which is a short-acting na ganglion blocker. Pero we cannot also give this orally Therefore, ginahatag siya intravenously. So specifically, IV infusion. Okay, IV infusion siya. So para asa ang ato ang trimethophan, ginagamit siya for hypertensive emergencies and dissecting aortic aneurysm. Wait lang, let me discuss what are these two na conditions. I believe you are very knowledgeable about hypertension. However, pag nahimo na siya og hypertensive emergency, mauna ni siya ang iyahang BP is more than 180 over 125. Okay? This is a board exam question, ha? You have to take note of this. If we call it hypertensive emergency, ang BP sa patient ana is more than or equal to. Kapag mutungtong na siya or more than 180 over 125, it's considered hypertensive emergency. Aside from this BP with end organ damage. Again, hypertensive emergency na siya if ingana nakataas ang iyahang blood pressure and at the same time na anay end organ damage. So pwede na siya nga organ, pwede na siya kidneys, kanang na siya kanang end stage or terminal stage na kidney disease. Kapag nagsabay na siya, hypertensive emergency ang tawag. Okay? Questions about the hypertensive emergency? Actually, duha man ka klase na hypertensive crisis ang tawag nato sa ilaha. So, hypertensive crisis, duha ka klase na. Number 1, kani siya, hypertensive emergency. Mo ni siya ang meaning sa hypertensive emergency. Tapos, ang ikaduha, hypertensive urgency. Okay, basig ma-encounter ninyo siya puhon. Kani hypertensive emergency. The other one is hypertensive urgency. Silang duha, two kinds of hypertensive crisis. So, ang urgency naman is lang siya, BP lang siya na equal or more than to 180 over 125 without the end organ damage. Okay, mo na ang ilahang difference. Questions? Pero ang uban, actually, na yung mga tao nga maabot nag 200 ilang BP, parang wala lang nangyari, no? Na yung uban tao, they are not that sensitive when it comes to the increase in their blood pressure. Pero ang problema man gud ana, kung taas na kaayo, pwede na mambuto ang ato ang mga blood vessels. Power. At ang problema kay mukalit na lang sila og ka-stroke, kana ang uban mag-aneurysm. When you say stroke, naa na siya like blood clot, like obstruction in the blood vessel in the brain. Okay? So ang effect sa stroke is depende kung which part of the brain is affected. That is why you can see if a person does not die with a stroke, na kung makasurvive siya sa iyang stroke, na ay different na mga effects afterwards. Ang uban sa ilaha ma-paralyze kasi ang affected na part sa brain is on the movement. Napoy uban nga makalimot because ang part pod sa brain na affected is the memory. And then ang uban kay napoy kanang dili ka istorya kasi affected ang part sa brain responsible for speech. So depende ang sa stroke, okay? Naay uban because emotions can also affect our blood pressure, okay? Emotions can also affect our blood pressure. So there will be times na like grabe excessive ang emotion, no, kanang like suko kaayo or lipay kaayo pwede na siya maging hinungdan na there will be increase in the blood pressure. Okay? So kung ang inyuhang, like imuhang parent has this condition, then hinay-hinay lang sa when it comes to emotion. Okay? Next question. Yeah, ang sa aneurysm man God, when you say aneurysm, naay part sa imuhang blood vessel, anywhere man gud ang aneurysm, pwedeng sa brain, pwedeng sa aorta. And di ba the aorta is our very large blood vessel na ipadulong sa heart, na gani tay gastric, thoracic na part na aorta. So that's a very big blood vessel. So pag moingon ka og aneurysm class, there will be a like balloon sorry. Wait lang ha. Like mo balloon ang imuhang blood vessel and then padulong naman gud siya mo buto. So pwede na siya mubuto and then pwede kamatian sa patient. So pag moingon kag dissecting aortic aneurysm, the aneurysm na part is in the aorta, and then when you say dissecting, murag nagdako na siya, and then at the same time there will be laceration. Pag magisi na ang ang aorta, kay grabe na ang pressure, no, there will be hemorrhage. Okay? There will be hemorrhage. Mo na tong ginapangita sa case ni Christine Becerra. Pero dili, I have seen clips na si Dr. Fortune nag-istorya kasi the medical legal report is not complete. So dili siya complete kay tungod giimbalsa mo Manila before nila gi-autopsy. Kung wala to nila giimbalsa mo, since they are claiming na she died because of aortic aneurysm, makita jud dito na there is hemorrhage. Okay? Naadjud to hemorrhage if it's because of the aortic aneurysm. Pero kay nalimpyuhan naman ang iyahang body, then dili na siya makita. Okay? So kanusa mag aneurysm ang isa ka person, pwede siya because of like taas nga blood pressure. That is why I heard someone, I cannot remember who, I think it's Dr. Fortune, but na-mention niya na maybe na ay undiagnosed hypertension si Christine Becerra. Undiagnosed siya. So, nagataas ang iyahang blood pressure na nauwi into aortic aneurysm. Okay, questions? Pag nagapuyat ka perme. Yeah. Like I know someone na nag-aneurysm, 13 years old. Namatay dito siya sa iyahang aneurysm sa ulo man to. Ano man good to siya kanang grabe siya mag-games. So pulaw, tapos pagkahuman asing tibuok gabi nagatubang lang sa computer, nagadula, and then walay saktong kaon, walay saktong tulog, walay saktong kaon. And then there was a time lang na marag 3 days gasakit iyang ulo. On the 3rd day, galit na siya katumba. And yes, it's aneurysm, 13 years old. Aneurysm is not actually common to younger people. It's common to older ones because prone na sila sa ingana kay mutaas na ilang blood pressure, mugahi na ilang mga blood vessels, ang resistance grabe na. I mean resistance sa flow sa blood nagataas na siya as we age. So sila ang prone for that. Pero naay mga cases sa mga batanon nga naga-aneurysm because of kana lifestyle. Okay? Naay mga drugs, yes, na naga-trigger og aneurysm, especially those na mga abused drugs. Okay? Cocaine can do that because cocaine can dilate your blood vessels to the extent na mag-burst siya. So, pwede si cocaine. I don't know with shabu. I'm not that familiar with shabu if it can be cause of aneurysm. Alcohol, if it's a very high dose na alcohol, na like ang imuhang giinom ng mga hard na mga drinks na grabe na ang proof no or ang percent sa alcohol 60% nga daghan na kaayo mong giinom klase-klase. Maybe there will be a small percent na it can cause aneurysm. Okay? Questions? But take note class, trimethophan is a short-acting drug. Nag-a-act siya sa ganglion blocker. It's an antagonist. I mean, ganglion, sa ganglion siya nag-a-act. It's a blocker or it's an antagonist and it can decrease the blood pressure. That is why it can be given to people with hypertensive emergencies at the same time dissecting aortic aneurysm. Okay? Artista sa artista sa Korean na artista na naa siya aneurysm. Si Jung Il-woo. Kailan mo sa iya ha? Ano sa kanina yung palabas? Kalimot ko. For Cinderella and Four Nights, yeah, I have seen that. Katong bida dito na lalaki. And wala na ko kabalo sa iyang uban nga palabas. Basta I have read sa news na murag nawala siya for pila ka years kasi may aneurysm siya. Though wala nagbuto ha, wala nagbuto, yeah, na siya sa brain at niya. It's I think hereditary for his case. Pero ginaalagaan kay syempre lisod man pud mo buto no. And dili pa ata siya pwede operahan. Kana.
Ma'am, na siya brain aneurysm.
Pero is she okay? Sakit ng
Na
ulo.
apo ma'am, ano na siya, na nag-undergo na siya og surgery ma'am.
Okay.
Mata kong napunta na sa tong tawag katong clip good ma'am nagibutang.
Si clip.
But murag na daw sila gi-insert na clip ma'am na mo daw tong explanation sa doktor. High school pa good ko ato ma'am.
Wait lang. I'm not that familiar. Let us see. Kung unsay ginahimo nila. That is for the repair of the brain aneurysm, no? Kapag ka naman kung kay aneurysm na ay part sa imuhang blood vessel na weak. So, weak siya and then mag-bulge or mag-balloon na siya. So, kailangan siya like i-correct. So, naatay, I don't know what's the name, pero yeah, aneurysm clipping ang tawagan na. So, ginaklipan para dili na good siya like maagian og blood. Kay pag the more siya agian og blood, remember weak ang blood vessel, mo na mag-burst siya. So mo nang ilahang butangan og clip para dili siya agian didto og blood. So siya, pwede siya mag-redirect ang flow sa blood mo. Agi na lang siya sa uban nga blood vessels. Mo na siyang ginahimo sa surgery. I don't know the name. I think it's aneurysm clipping. Wala.
Lifetime.
Yeah, to dito.
Or mag-expire pa to ma'am.
I don't know kung mag-expire ba na siya. I'm not sure. Pero ang akong balaan ka na, ginaklipan na nila. Dili lang ko sure kung mag-repeat surgery ba na siya kay ilisan ka na ako ang dili sure. Mawala ang aneurysm pag operahan. Okay? Like katong giingon ni Jai na klipan. Ang uban kay mag-reroute. Ang blood kay i-reroute sa uban nga blood vessel. Okay? I don't know with the like buhos diretso sa ulo pag maligo ka. Pero actually, I don't do that, manggod. I don't know if it has something to do with the aneurysm, ha? But ako, pag nagaligo ko, dili jud ko buhos diretso sa ulo maligo. Tiil jud ko. Ko kanang by step, kadi ko gusto tugnamon. Like, tiil akong unahon, pasaka, hangtod makaabot ko sa ulo. I don't know if it has something to do with the aneurysm. Ha? Ano sa pisik-pisik gamay usa mo sugod og ligo. Okay, do not forget na ang mechanism of action of these drugs is they block the nicotinic receptor in the ganglia, okay, or in the ganglion. So para acetylcholine cannot bind to it and dili siya maka-take og iyahang action. Makasakit og ulo. Makasakit og ulo basta ulo ang mauna. Kana lang. Okay, questions, class, about these drugs? Wala. So let's move on. Let's summarize, class, our anticholinergic drugs. So for motion sickness, we have the scopolamine. Actually, the mechanism of action of scopolamine in the central nervous system, why it can treat motion sickness is still unknown, but ang iyahang action as an anticholinergic is known. It's the binding in the muscarinic receptor, therefore inhibiting acetylcholine and other agonists na mag-take og effect. So you can give scopolamine to patients after surgery because there is the nausea and vomiting na effect of the anesthetic agents. And then we can also give this to people with vertigo. So kanang vertigo, wala siya ang condition na magtuyok jud imuhang pananaw, whether you stand up or nagahigda ka, nagatuyok jud imong pananaw pag naa kay vertigo. And vertigo has daghan siya og cause. Okay, daghan siya og cause. Pwede tungod sa imong migraine, pwede siya tungod sa problem with your ear. So naay, 'di ba, ang balance nato nasa ear, ang ato ang organ nga nagakontrol sa balance. So kana pag may problema ka din pwede ka mag-vertigo, pwede pud siya mga tumor sa ulo, naga-cause pud na siya og vertigo. Okay? So again, pwede siya sa motion sickness and post-operative nausea and vomiting. And then for gastrointestinal disorders, we have the dicyclomine. By the way, class, other name of dicyclomine is dicycloverine. Sulat na ako. And kabalo ko nga kaila mo sa iya dicycloverine. So pwede na to siya ihatag sa mga patients with kanang spasm sa tiyan, pagsakitan og tiyan, class, we can give dicycloverine kasi this is an anticholinergic drug. So baliktaron nimo ang diarrhea. When you say diarrhea, you have fast peristalsis, fast na motion sa imuhang gastrointestinal muscles. So slow down nato using this drug. That is why dicycloverine can be given to people with irritable bowel syndrome. And then, para sa mga minor diarrhea. So aside sa dicyclomine, we also have loperamide. So the same ang mechanism of action ni loperamide, the same pod ang iyahang effect, the same clinical application. It's just that, again, when you say loperamide, you have to take a loading dose. Pag mayroon kag loading dose, pag diarrhea ka, on the first take nimo sa loperamide, you really have to take 2 capsules. Naka-capsule ato ang loperamide, class. Di mo kakitag loperamide nga naka-tablet. Naka-capsule na siya, so you have to take 2 capsules. Ang tawag na to ana, loading dose. So the purpose of the loading dose is para mapaspas pud ang pag-achieve sa peak plasma concentration, para mas daghan ang maadto sa blood and makatake na siya og action dayon. Okay? So loperamide na siya, loading dose, 2 capsules, and then you can take the next dose after 4 hours or after ka makabawas na sad. Questions, class? I-appeal na ako si loperamide because I cannot see loperamide in the book. I can only see the dicyclomine. So, pero ang loperamide man is more common in the Philippines. Isa na lang, okay? Isa na lang imuhang inumon. Ang loading dose lang, ang first dose lang gid ang duha. Pero ang mga succeeding doses nimo, isa na lang, ha? Isa na lang ka capsule. Okay? And then we have other drugs that can be used as anticholinergics para sa tiyan. Like kung naakay diarrhea or naakay spasm. So you can use the hyoscyamine na longer iyang duration of action compared to the other two. And the glycopyrrolate, which is not common in the Philippines, but it has similar effect with that of the dicyclomine or the dicycloverine. Okay? And then we have for ophthalmology, we have the atropine. Remember, when you administer atropine in the eyes, the action is very long. It can even last up to days. But the effect of atropine in the eyes is dilating, meaning mydriasis. So there are examinations in the eyes like retinal. If the doctor wants to examine your retina, then kailangan manggod imuhang mata dilated ana. So man siya gamiton si atropine. However, do not forget na atropine is very contraindicated to glaucoma. Because when you say glaucoma, you have increased intraocular pressure. And if the person experiences dilation of the pupil, musamot kataas ang intraocular pressure. Okay? Pag mayroon ka glaucoma class ha, kay mara siya hypertension sa mata. Next, we have for the respiratory system, we can give this to asthma and COPD. Na-mention ako siya kagaina, it's the ipratropium. We have the Atrovent in the market. It's a single drug. However, mas common si ipratropium na nakakombine with the salbutamol. So if you have your duty, internship sa community, mas makita ninyo si ipratropium na nakakombine with salbutamol. That is why we have the Duavent, the Combivent, combination siya of the two. Okay? Para na siya sa mga bronchospasm para mag-relax ang bronchioles and matreat ang asthma o COPD. Pag na-asthma or COPD na ay bronchoconstriction. Okay? And then, we have for the urinary incontinence, we have the representative drug, the oxybutynin. Para mag-relax pod ang muscles sa bladder para matreat nato ang urinary incontinence. Again, that's oxybutynin. Kanya sila ng mga drugs, they are anti-muscarinic. Sila? More on the muscarinic receptor. And do not forget if the person experiences cholinergic poisoning, katong mga masubraan og acetylcholine and the likes like pilocarpine. And then, what else? Katong mga tigmins nato, pag magkaroon ng poisoning ato, ang ato adyong best antidote is the atropine. It's a mandatory antidote for cholinesterase inhibitor poisoning. Itong mga tigmin and mga onium, and itong mga ecothiopate, soman and sarin, we use atropine as antidote. However, if the poisoning is still on its early stage, like 48 hours pa lang ang nakalipas, then we can use this drug, the pralidoxime. So, ang mechanism of action niya is actually nag-regenerate siya sa mga active na acetylcholinesterase. Diba itong mga drugs like neostigmine, ang ilahang mechanism of action is ilahang gina-inhibit si acetylcholinesterase. So pag wala na yung acetylcholinesterase, wala na yung muguba kay acetylcholine, and then ang result, mudaghan si acetylcholine. Na kung nag-poisoning, na sobraan og inom ang patient, then if it's on the early stage, we can use this drug, pralidoxime, para mag-regenerate si acetylcholinesterase. And then, mag-bind siya sa phosphorus atom dito sa ato ang chemical. It does not enter the CNS. Pero pag once na nag-bind na siya dito, mapuhi na ulit si acetylcholinesterase. Okay? Pero again, do not forget, early stage pa dapat. If more than 48 hours na, you cannot use pralidoxime anymore. We only have one option, and then that's atropine. Okay? So aside from pralidoxime, we also have DAM, the diacetyl monoxime. Both are given IV, and both of them are cholinesterase regenerator compound. Pero kani sila is not recommended to carbamates. When you say carbamates, katong nag-end sa tigmin. So we can only give this to onium na mga drugs, and actually sa mga mushroom poisoning, pwede nato ni gamiton si cholinesterase regenerator compound, pero dapat during the early stage. Okay? Now let's talk about mushroom poisoning. So nganong ma-appeal si mushroom dire? Kasi remember class, muscarinic receptor, the receptor of acetylcholine. Muscarinic receptor, it's named after the alkaloid called muscarine na makita nato sa mushroom. Okay? So pag naka-ingest ka o mushroom na supposedly dili dapat pwede ka unon, you will have a lot of muscarine, and then the muscarinic receptors will be activated. Thus, the effect kapag mag-mushroom poisoning class, dumbbells gihapon. Okay? So, di ba nagkakaon man tag mushroom, no? Sa Jollibee, daghang mushroom. Pero kana nga mushroom na ilahang ginabutang sa food, it's actually cultured. Cultured na siya nga mushroom. Kana gud ilahang, sige no, pagkaon nila nga na mushroom. Burger steak. Tama no? Burger steak na mushroom.
Pati sa KFC din, ma'am.
Ay, ang KFC na pud mushroom, no? It's a cultured one.
However,
ansa? Ansa to?
sa McDo po, ma'am, may mushroom.
Sa McDo, sa dili magukuhingaon og kanang fast foods good. So, I'm not that,
Sa among likod bahay, char.
Sa likod bahay. Wait lang, na question si Isobel. Dire karon lang ko kita. Mag-lead di ay to vertigo, migraine. Yes, Isobel. If you have migraine, it can lead to vertigo.
Anan ba, ma'am?
No, not really. Pero it can lead to vertigo. And tinnitus also. Are you familiar with tinnitus? I have tinnitus kasi. Mag-ring. Pagwingon kag tinnitus, it's ringing in the ear. Saba imuhang dalunggan. Murag na ay unsa to anak kanang anang sound. Nako ing anak. It's because of, I don't know, sa akong migraine or sa akong rhinitis. If I blow my nose, kanang grabe gud akong pag-blow sa nose, di ba mo ano ang imong dalunggan. I have that. So aside from
Same, ma'am. Bakit kaayo?
Yeah. So labi na ako kasi I have my rhinitis. So sipunon jud ko pirmi class. Kay sensitive jud ko ilong.
Apir mga sipunon, ma'am.
Yes.
Rhinitis.
Actually, murag adlaw-adlaw class na jud ko sipon. I'm very sensitive to smell, to kanang mga abog. Di jud na pwede sa akong ilong. That is why kanang dili ko pala silhig kay dili na kaya sa akong ilong. Kanang labi na basta mo na ang abog, di na jud na siya kaya sa akong ilong. So permi ko na ay sipon, and then nagatinitis na rin kung saba na akong dalunggan. I've tried having vertigo. Actually, kapoy kay siya, lami kay siya ihilak. Kay kanang bisag naghigda na kamutuyok gihapon ang imuhang pananaw. And nakatry ko mag-vertigo college. Lisod kay siya niya, tuyok ang pananaw nga nagatabok ka sa dalan. Yeah, migraine actually, maghilak na ko. Last time, marag twice na ako nag-migraine kay marag sunod-sunod akong pulaw. Mao din na ang kalaban man sa akong migraine pag nagapulaw na gani ko. Ya sunod-sunod na expect na jud kong migraine ani. And pag may migraine ka, you are sensitive to everything, to light, to noise, kapoy kaayo. High school pa ko may migraine ako. Pero mine is optical migraine. It's because my eyes. Pagka-lizard. Okay. Anyway, let's go back to mushroom poisoning class. Dili tanang klaseng mushroom makaon, ha? Again, dili tanang klaseng mushroom makaon. Ang inyong tandaan, the more colorful the mushroom is, the more poisonous it is. Nakuha? The more na colorful ang mushroom, the more poisonous na siya. So, wa ka kita, class, wa pa man ta kakaon no og colorful na mushroom. Mostly jud sa atong makaon nga mushroom kanang dili colorful, kay pag naging colorful na siya, automatic it's poisonous. So naatay two types of mushroom poisoning. The first one, kulayan ninyo sa mukay. The first one is rapid onset na type. Pag rapid onset ang poisoning, ang dumbbells, I'm talking about the effect of the mushroom dumbbells ha, parehas kay acetylcholine. Kay, again, muscarinic receptor. Ang dumbbells, ma-experience na dayon sa patient within 30 minutes to 2 hours after niya gikaon ang poisonous na mushroom. So kapag rapid onset ang mushroom poisoning, again, muscarinic excess siya, meaning dumbbells pero excessive. The person will experience diarrhea, urination, lacrimation, and all kinds of dumbbells class. And kapag kaingani ang poisoning na after 2 hours, nag-dumbbells na dayon ang patient, our antidote for this is the atropine. Okay? Atropine ha. So, dili patakaog kaon og mushroom. Sige, unsang klaseng mushroom ginakaon ninyo?
Ma'am, kanitong mushroom nga naay muscarin, ma'am.
Oh, yeah. Yes.
Ang mga mushroom na naay muscarin, ma'am, naapoy psilocybin.
Not all.
Pero naay duha gyud, ma'am, ang muscarin jud ang psilocybin na isa ka mushroom lang, ma'am.
Yeah.
So excessive dumbbells plus mag-hallucinate pa jud ang patient, ma'am.
Yes. And it can lead to death, psychosis, and then death. Kana tong lisod. Lisod, no? Pero ang mushroom ang good nga na psilocybin, it's the peyote mushroom. I don't know how it looks like. Kung ako balon sa inawong ana, wala pa ako kita. And ang makita lang dyan ako nga mushroom, kana ganing ano. Kanang ingon nila ihi sa iro. Mushroom man dyan na, no? Ganong mutubo man na siya. Kapansin mo, class, basta mo kidlat. Pag mangihi ang iro na yung mushroom mutubo. Ano man na. Pag mo kidlat, class, pagkaugma na, daghang mushroom mutubo. Kapansin mo, wala. Okay. Ano man sa ihi?
Mangihi lang iro, ma'am. Pero kung kidlat, marag abot lang. Wala.
Actually, sa ihi, manggo, there is urea. And ang pagkaon jud sa fungi, mushroom is a fungi, it's a fungus. Ang pagkaon jud ana nila nitrogen. So mo tubo gid na sila pag naiihi kay naman nay nitrogen ang ihi. And then at the same time kapag nagakidlat manggod class, ang kidlat will help sa nitrogen fixation sa soil. Sa yuta god, there will be nitrogen fixation after the lightning. And then mo na pagkaugma, class na adyo mo tubo mushroom pag humanog kidlat. I don't know if you have observed that one, ha? Wala mo kong gagawas ako po. Actually, I'm afraid of that. The thunderstorm kung niaging gabi, saba kay di ko katulog, samot kong migraine. I'm afraid of that, so I don't go out also. Pero actually, tinood na siya nga after the lightning, there will be a lot of mushroom anywhere. Okay? Alam mo, ako nagkakaon dyan kong mushroom, i-adobo, isubak-subak sa mga unsa-unsa, sa gulay. Kakaon ko, pero I don't know how to identify what mushroom is edible and what is not. It's just that I know that if colorful siya, poisonous siya, so I won't eat that. So, naapod tayo, ginatawag class of delayed onset. Kay rapid onset man tong first, kani delayed onset. And these are the mushrooms nga naga-cause og delayed onset. So we have the Amanita phalloides, the Amanita virosa, Galerina autumnalis, and Galerina marginata. These are the names of the mushroom na naga-cause og delayed onset na poisoning. Ang akong nabalaan lang si Amanita phalloides, ang nawong ani murag mushroom kanagong nagdula mo og Super Mario, di ba na ay mushroom diha sa Super Mario no kanang colorful colorant
Yes.
na ay na ay like bilog-bilog na puti.
Ay,
And sa
polka
Alice,
dots.
yeah, sa Alice in Wonderland also you can see that kind of mushroom. That's how Amanita phalloides looks like. And wala gina siya ginakaon class. It's a colorful one. It can cause delayed onset. Ganong delayed onset, the first symptom will appear 6 to 12 hours after ingestion. That's different from the rapid onset na within 30 to 2 hours, 30 minutes to 2 hours naa na si dumbbells. Kani, after 6 to 12 hours pa ang effect niya. Now, however, the patient can still experience dumbbells, pero ang pinaka-effect man jud sa delayed onset, ang target jud niya kay ang kidneys ug ang liver. Okay? Pag delayed onset ang ginakos sa mushroom, the target is the kidneys and the liver. Atropine can be useful for the dumbbells, but atropine is no longer used for the hepatic and renal cellular injury. That is why kapag delayed onset, atropine is not used anymore. So the patient can be, since the problem is the renal kidneys, the patient can be subjected to dialysis here, and uban pa ng mga tambalek for the liver kasi ang ma-injure jud ani, ang apektado jud pag delayed onset, liver and the kidneys. So okay lang katong rapid onset kung maagapan siya no, kay we can just give atropine because dumbbells lang man pud ang iyahang effect, excessive lang. Kani lisod na ni tambalan kay magkaroon og damage sa organ. Questions? I can finish man di ay the chapter 5. What time is it? I still have 30 minutes. So I can finish the chapter 5. So unsay muna to ugma. Nga. Let me think about it. Wala pa ko nabuhat og exam because I am waiting kung unsa kadaghan ako ang mahuman. Okay? Let's continue sa mga neuromuscular blocking agents nato. Again, neuromuscular blocking agents. Class, do not forget na si acetylcholine is an important neurotransmitter involved in muscle contraction. So, mo na siya nga natay like myasthenia gravis, cholinergic crisis na the patient cannot even open their eyes kay wala na kusog ang ilahang mga muscles tungod na siya sa problema sa acetylcholine. Pero napud tay sa side na pwede nato i-block ang effect ni acetylcholine dito sa muscles. So natay mga drugs that will block the cholinergic transmission between the neurons and the muscles, I mean the nicotinic receptors nga makita sa skeletal muscle. So natay two types sa neuromuscular blocking agents, the non-depolarizing or the competitive blockers. They are considered true antagonists kasi they will really block the nicotinic receptors and acetylcholine can no longer bind to the receptor, especially sa skeletal muscle. So ang tawag nila sa ila again, non-depolarizing or competitive blockers. And then, ang ikaduha, we have the depolarizing agent. Though considered siya nga neuromuscular blocking agents, pero actually agonist jud ang iyahang action. So later we will find out why it is called agonist. Bisag gitawag siya neuromuscular blocking agents. So let's start with the non-depolarizing blockers. We have the curare, which is considered a poison, a South American arrowhead poison. It can cause paralysis. It will block the action of acetylcholine sa muscles. Then we have like drugs pattern to curare. We have the trubocurarine, the atracurium. Nowadays, we have the cis-atracurium, pancuronium, rocuronium, and the vecuronium. That's how you identify them na non-depolarizing blockers sila kanang ending sa ilahang name. So I don't know if you have, if you are fond of watching K-dramas. Kay ako nagatanaw jud kog K-drama, especially if it's a medical drama. And this is where I can see this drug. Dito na ko ni sila pirmi makita sa mga medical dramas nga Korean. Especially the Doctor Stranger, I have heard them talking about the pancuronium and the rocuronium. Pag ano ka, pag dili ka medically inclined, you're not a doctor or a pharmacist, you're not really familiar with this drug. Pero pag magtanaw kong Doctor Stranger, I don't know if nakita niyo na Doctor Stranger had, pero di ba ang babae din ha, kay anesthesiologist. Si ano man ano, Lee Jong-suk. Istorya tayo Doctor Stranger dire ha. So that makarelate niya itong ginaistoryahan. Okay, si Lee Jong-suk na. Ang babae din hang uyab niya is an anesthesiologist. And then before nganong magistorya ta ni kasi before maguna sila muhatag og anesthesia, they will give non-depolarizing or they will give the blockers, the neuromuscular blockers. Ihatag sa nila. Muna usahay madunggan ako sa sila, 'di ba, before sila muhiwa, mag-anesthesia sa, and then iingon sa actress didto kung unsa ang iyahang gihatag. So usahay iyahang ginaingon kay rocuronium, ang usahay pancuronium. So again, ginahatag ni siya before the anesthetics. So ngano, because of its mechanism of action, at low dose, these drugs, the non-depolarizing agents, will block acetylcholine sa nicotinic receptor. I-block nila si acetylcholine sa nicotinic receptor, especially the nicotinic receptor found in the skeletal muscle. So pag na-block si acetylcholine, walay muscular contraction. It will lead to relaxation. So mo ni sila class ang ginatawag natog muscle relaxants. Okay? Again, mo ni sila ang atong ginatawag og muscle relaxants. Before ang iyahang clinical application jud is gina-employ siya sa anesthesiologist para ma-shorten ang duration and ma-monitor nila ang pag-block sa neuromuscular junction, ang pag-block sa acetylcholine dito. Kapag kadili man gud sila mohatag og muscle relaxant, it will require high dose sa anesthesia para mag-relax ang mga muscles and mag-effect ang anesthesia. Kani hatag sa silag muscle relaxant para mapadali and maggamay ang dose sa anesthesia. Mao na siya ang reason. So the next time when you watch like dramas, since we cannot go to the operating room and observe, so when you watch dramas, you take note of the drugs na ilahang mga ginagamit. Kasi di man guganahan kung sa Philippines na kasi it's nowhere near reality. Pero ano mga like mga K-drama na ko nga ginatanaw, they really use and they really present like mga tinuod nga scenario like in the operating room. So they present tinuod na mga drugs na ginagamit. Umo na siya kani sila. So again, mao ni ang mechanism of action ha. Pero if we want to reverse the effect of these drugs, we can just use neostigmine. Kung gusto na to i-reverse no, na mahuman na ang iyahang muscle relaxation, we can just give neostigmine. This will be the antidote. However, our problem, if mahatag nato in high doses ang atong mga muscle relaxants, mga non-depolarizing na mga neuromuscular blockers, it will lead to the blockage of the ion channels sa motor end plate sa mga muscles. Okay? Pati ang mga ion channels ma-block na, not just with the acetylcholine. Ma-appeal ang mga ions. Remember, aside from acetylcholine, we need ions for our body to function. Even sa ato ang mga muscles, kailangan nato og ions. So kung mahatag nato siya high dose, ma-overdose na ang patient, maglisod na ta anig reverse. We cannot give the means the cholinesterase inhibitors anymore for this. So, atong problema kay nag-relax na gyud ang muscle, dili na siya mo react, dili na siya mo contract even if maghatag taog stimulation like electrical stimulation, the muscles won't react anymore. So it will be paralysis. Dili na mo na siya ang ginaiwasan sa mga anesthesiologist kasi sila ang nagagamit ani na drugs. So what is the action? Kapag ka maghatag taklas og non-depolarizing agent, it will lead to paralysis of the muscles, pero it's temporary at low dose. It can be reversed. So naay sequence kung unsa ang pinakaunang ma-relax or ma-paralyze. So it will start with the small rapidly contracting muscles sa face and the eyes. Mauna jud og kaapektuhan, ma-relax ang mga small muscles na to sa nawong, sa mata. And then we have fingers, limbs, neck, trunk muscles, and mga intercostal mga muscles, mag-react na siya. And ang pinaka-last nga mag-relax or ma-paralyze will be the diaphragm. Okay, the diaphragm here. They will also know, class, kung okay na, kung nag-react na. They will, islito nila ng trapezius muscle dito sa may, what you call that, sa may abaga. Kaya pag mo-react pa ang patient, pag pindot diri sa muscle, meaning wala pa nag-relax, wala pa na-paralyze. So, ingana na nila mabalaan kung nag-effect na ba ang muscle relaxant and even ang anesthesia. However, class, ang pag-recover, di ba, after operation, ginabutang man na ang patient sa recovery room before siya ibalik sa iyahang room mismo. So sa recovery room, ginahulat na mag-recover ang patient from the effect of the muscle relaxants as well as the anesthesia. So ang pag-recover ani class, it's on the reverse manner. The first that will recover is the diaphragm and then the mga larger muscles hangtod ang pinaka-last mag-recover itong mga gagmay nga muscles sa face o sa mata. Okay? Yeah, ginahulat makamata. Kay kung ano man siya class, last man mag-recover ang mga gagmay na mga muscle sa mata, no? So, muna na siyang indication nga naka-recover na ang patient if he or she is able to open his or her eyes. Okay? Questions? Wala? So, let's talk about the adverse effects. Si pancuronium lang kay naa siya adverse effect na makapa-increase siya sa heart rate. Okay? Makapa-increase sa heart rate si pancuronium. And then, I have my assignment sa inyo, ha. I want you to read. We will have our ano na lang tomorrow. Recitation. Para natin mo, pahumanay na ko kasi, and it's 5:40. I want you to read this, the drug interactions. Unsa di ay ang effect nganong unsa ang drug interactions between the non-depolarizing agents with the cholinesterase inhibitors, and then you also research for the drug interaction between the non-depolarizing neuromuscular blockers and the halogenated hydrocarbon anesthetics, and then aminoglycoside antibiotics also, and the calcium channel blockers. Ako among isa-isahon ugma. Okay. Ay, wala pa rin ako nabutang itong beverage na. Sa ano to siya, sa farm chem to, no? Sa ibutang lang nako later. Sa farm chem tong sa types of beverages. Pero I want you to read for this one tomorrow. Ako among singlon tomorrow para dili lang ako tanan ang nagasupply sa inyong ha. Mag-research sad ta and then we will explain tomorrow unsa day na ng mga drug interactions nganong pwede or dili sila pwede isabay with the non-depolarizing neuromuscular blockers or our skeletal muscle relaxants. Okay? Questions? Play? Buhi pa mo dira.
Ma'am, pwede pa ulit sean?
I just want you
Ma'am?
to research about the drug interactions between these drugs, kani silang apat, and the neuromuscular blocking agents, specifically the non-depolarizing neuromuscular blocking agents. Unsa ilahang drug interactions? Kung isabay nimo si pancuronium ug si cholinesterase inhibitor, maunsa ang patient? And kung isabay nimo si rocuronium and si halogenated hydrocarbon anesthetics, maunsa ang patient. That's what I'm looking for. And mao na inyong i-research and i-discuss na to tomorrow. Questions? Wala. Wala. Okay, so let's have the depolarizing agent. This will be the last one. It is also considered a neuromuscular blocking agent, however, depolarizing siya. Okay? Depolarizing siya kasi agonist siya. Meaning, its action is similar to acetylcholine. Again, similar kay acetylcholine ang action ni depolarizing agent. It can stimulate, it can activate the nicotinic receptors in the skeletal muscle. Ma-depolarize. When you say depolarize, di ba kay mahimog more positive ang inside sa cell. And pag nahimo na siya more positive, the cells will become excited. That's how acetylcholine works, and that is how depolarizing agents also work. The only difference of the depolarizing agent and acetylcholine is ang depolarizing agents nato are resistant to degradation by acetylcholinesterase. So dili siya maapektuhan ni acetylcholinesterase enzyme. And actually, isa lang din niya ato ang depolarizing agent. That is the succinylcholine. This is the only depolarizing muscle relaxant na ginagamit as of today. Now, let's talk about the mechanism of action. Why is it called an agonist or a depolarizing agent? So, si succinylcholine class, when given to the patient, will bind to the nicotinic receptor. Mubind siya kay nicotinic receptor and naa siya effect. Ang iyahang effect parehas kay acetylcholine. Again, parehas kay acetylcholine na pag na-activate si nicotinic receptor, sodium channel will be opened and then sodium will enter the cell. It will result to depolarization. Pag depolarization again, mag-positive ang inside sa cell and then it will activate the cell. Now, since the cells I am talking about here are the muscles, meaning ang effect ana will be transient twitching of the muscle or fasciculation. So naay phase 1 o phase 2 ang effect ni succinylcholine. Phase 1 class, pag bind ni acetylcholine, mag-experience ang patient og muscle twitching. Makita na nimo kay murag mag-fasciculation, mag-contract ang iyahang mga muscles. Mana siya nga depolarizing agent. And then pag abot sa phase 2 man good, ang mahitabo mga dani nga nung ginatawag gihapon siya neuromuscular blocking agent or skeletal muscle relaxant. Pag napuno namang good ang sodium, okay na tanan sodium, like naka-enter na sila sa channel, napuno na ilahang mga receptors, maghinay-hinay na nagkawala ang action ni sodium. And repolarization will take place, makabawi ang cell, pag depolarization, maging more positive siya. Pag repolarization, maghinay-hinay na siya ug ka-negative. And by that time, sodium channel will be closed and will be blocked kasi daghan ng sodium sa sulod and then nagahinay-hinay, nagkawala iyahang effect, leading to flaccid paralysis. Okay? Pag flaccid paralysis class, dili siya manggahi ang patient. Wala siya kusog. Meaning ang iyahang mga muscles walay kusog, humok, walay kusog. Ana siya ang effect ni succinylcholine or ni depolarizing agent. After niya mag-contract ang mga muscles, mawad-an siya kusog. So skeletal muscle relaxant gihapon siya. Dili lang siya pareho kay non-depolarizing agent. Si non-depolarizing agents manggod katong mga pancuronium ug rocuronium, diretso manggod yang effect. Pag administer nimo, mag-relax na dayon ang muscle. Si succinylcholine mag-contract sa ang muscle, usa siya maluya and ma-paralyze or mag-relax. So mo na nga naay phase 1 and phase 2 nga effect or mechanism of action si succinylcholine. Okay? So again, ang actions ni succinylcholine, there is a brief muscle fasciculation first, and then mag-cause siya og muscle soreness. And then, ang pinaka-last nga ma-paralyze is the same thing. It's the respiratory muscles or involved gihapon si diaphragm. Okay? However, class, ang effect ni succinylcholine is very short, though it is not degraded by the acetylcholinesterase, pero naapod tay lahi nga enzyme nga muguba kay succinylcholine inside the body. It's called pseudocholinesterase. So it's another enzyme. Si acetylcholinesterase will degrade acetylcholine, however, si pseudocholinesterase dito siya kay succinylcholine. And this is the reason why it has extremely short duration of action. So para asa si succinylcholine, nganong ginagamit gihapon siya? Nga gusto man nato mag-relax ang muscle sa patient, pwede man unta gamiton si non-depolarizing agent. Si ano class, si succinylcholine ginagamit siya for rapid endotracheal intubation before mag induce og anesthesia. Kabaluman mo anang intubation kay pirmi man na ninyo makita sa mga Korean nga medical drama like this one. 'Di ba pag naay emergency patient niya, di makaginhawa og sarili niya ang patient, naga-intubate na dayon sila, mo nila hang ginagamit. So before sila mag-intubate, nagahatag sila og muscle relaxant. Dapat magud paspas ang effect, and mao na siyang advantage ni succinylcholine. Paspas ang iyahang muscle relaxant na effect, do mo contract sa kadali ang muscle pero mo relax lang pud siya after. So para magud makasulod ning tubo, kailangan i-relax ta ng muscles dinhi. Kada this will be very painful class. So i-relax na siya, gamitan natog succinylcholine before intubation. We call this endotracheal intubation. Okay? So man na siya ha, ang iyahang nawong paano siya ginahimo. Mga doktor hawd ana no silang naga-practice ana. And then aside from that, we can use the succinylcholine during electroconvulsive shock treatment. Kaning electroconvulsive shock treatment, ano ni siya, kanang kurintihan ng imuhang mga nerves. As in kuryente yun, literal na ginakurintihan. So para asa siya, ang uban ginagamit ni siya sa mga psychiatrist para i-correct ang mga nerves, especially kanaganing mga naay depression. Pag ang depression class kanang dili na matabang sa mga tambal na available, talk therapy, tambal dili na siya matabang, usahay they opt to have electroconvulsive shock treatment. I-kurintihan ang mga neurons, and then kanang mabag-o gani ang iyahang flow, ang iyahang firing, mabago iyahang firing, leading to treatment sa depression. Aside sa depression, kanang mga mental disorders, mga psychosis, schizophrenia, we can do the electroconvulsive shock treatment. So ipa-relax sa ang mga muscles before ang procedure. Okay? Questions about the use of the succinylcholine? We don't give succinylcholine during operation, during surgery, because again, it has a very short duration of action. Kaya pa? Last slide. Adverse effects na lang ni succinylcholine. If magkaroon og poisoning or toxicity, the patient will experience malignant hyperthermia. When you say malignant hyperthermia, kanang mukalit og taas kaayo ang ilahang temperature. Hyperthermia, taas nga temperature, and then leading to effects sa organs na dili na sila maka-function sa kataas sa sa body temperature. This is a board exam question. Drug of choice for malignant hyperthermia, antidote, dantrolene. Again, drug of choice nato for malignant hyperthermia is dantrolene. And then we have apnea. A means no. And then kapag ka makakita mo ani, it means breathing. So pwede nga dili na makaginhawa ang patient kay pati iyahang respiratory system na paralyzed. And then we have hyperkalemia. There will be increase in the potassium since nag-relax ang mga muscles, dili na to magamit si potassium, mutaas ang potassium sa blood. Okay? Questions, class? Nahuman dyan na ko siya. It's 5:52. Naluya na mo diha. Information overload.